So, brothers and sisters, I welcome you to this very important occasion. I trust that this is going to be the first of many meetings. Dr. Molaoa is from the Eastern Cape, and after pushing him very hard, we discovered that he's not only a general surgeon, but Dr. Molaoa is connected and head of general surgery at the Nelson Mandela Hospital. He's also connected as an academic at the Walter Sisulu University. And so we have somebody in our presence that is also got a post, degree in public health as well. So we are glad that he's with us. So without further ado, I welcome you to this meeting, and I invite Dr. Molaoa to please introduce the topic on the transmission of the virus and how do we minimize the risk.
Before I proceed, I would just want to introduce the sections that I will be talking about. Just briefly on the nature of the virus. There have been questions whether this organism is a virus or the bacteria, and how it is transmitted, and we're going to talk about the measures to minimize its transmission. This is a virus. Instead, it's not a bacteria. It is a coronavirus type 2. I think we did have a coronavirus 1, type 1, I think in around 2010. This is the second coronavirus. They have almost a similar structure. It is the virus that causes the disease, that is COVID-19. COVID-19 stands for coronavirus disease that emerged in 2019. And another thing that I want to define is an infectious period. We usually refer to people being in the infectious period. That is the period when one is the most or highly infectious, can transmit the disease to other people. Usually, it is about 2 days before you start showing symptoms and until the end of your symptoms when you get better. During that period, 2 days before you show your symptoms and about 3 days after your symptoms have disappeared, you are highly infectious, you can infect other people. The last definition that I want to make is the asymptomatic individual. We know about 80% of the people who are infected with this virus are asymptomatic, or some they have mild symptoms, which they tend to ignore most of the time. Those, I would say, they are highly dangerous people because they do not know that they are sick and they are transmitting the virus. This is, I think, most of the people have seen this slide on TV. This is how this virus is like. It's got some spikes. With these spikes, it attaches on the receptors on our throats and the nostrils. That's how from being attached on the throat and nostrils, it's absorbed into our mucous membrane, into our system. And unfortunately, we cannot see the whole of this, maybe the cross-section of it. It is covered with a lipid, that is fat. And that is a very important implication when it comes to hand washing. We know if you have fat in your hands, you simply take soap, wash your hands, the fat goes away. And they say it simply disintegrates if you wash your hands with soap and water. Now, how does it spread from person to person? There are 4 main ways. That is droplet spread. When I cough, I spittle. We spittle when we cough and we talk. We transmit it. Other people who are standing closer to me will be able to inhale it. Once hence it is important to maintain a good physical distance from one another, especially in church. We have to maintain a very good physical distance, and that's why we should wear masks. We wear masks to protect you, and you wear your mask to protect me. And also aerosol. You know, droplets, those are big droplets of saliva that we spittle out. The aerosol is very small droplets of saliva. They can remain floating on air for quite some time. And if you are not wearing your mask, you are transmitting the infection through aerosol. And if another person is not wearing his mask, he can inhale those droplets. They remain on the air for quite some time. And ultimately, they'll drop down on the surfaces. Therefore, it is claimed that if you walk on the surface with your feet, you can pick it up. But most importantly, if you touch the surface like the desk, tables, and everything that it has got the virus, that's how we can transmit and get it. And it's also claimed that it is a fecal era oral transmission. We can transmit it through when we go to the bathroom. Hence, it is very important to practice regular hand washing. Then I go back to the second way of transmission, the aerosol. People, they argue that aerosol is not airborne because it ultimately will fall down. I believe that we need to err on the side of safety and believe that it is airborne so that we can wear our mask all the time. So what it increases the risk of getting the infection. As everybody knows, during the lockdown, the purpose was to reduce the overcrowding on our streets. Crowded areas like in our churches, big church services, big funeral services, and in other places like in the discos, in the bars where people are coming together in bigger numbers, the risk of transmission is very high. Also, in the so-called congregate areas, congregate communities where there are many crowded houses in the small space. Like if you go to Kayalita, those are congregate places, the risk of transmission in those areas is very, very high. And also contact with an infected person within a distance of 2 minutes, of 2 meters, and within a time period of more than 15 minutes. I would rather err on the side of safety and say in the time period of less than 15 minutes, it imposes a very high risk of transmitting the virus. Or also touching the surfaces that are contaminated. We say everybody, especially everybody who are walking around, who are at risk of getting the infection. But who is at increased risk of dying from the disease? It is claimed that people who are at the age of 65 years and above, the risk is high. But we have noticed that even people who are younger than that, 60 years and above, even younger, people have seen people who are dying age 45 at their 20s, they are dying. The disease kills everybody, anybody. But the risk is very high in those elderly people, and hence they should really avoid coming to church unless it's really, really necessary. And people who have chronic conditions, like people who have TB, who have chronic lung disease, like in smokers, who have chronic bronchitis and emphysema, diabetic patients, and people with hypertension. Also people with AIDS, not necessarily AIDS, but HIV. There's no evidence that the risk in people who have HIV is higher than in other people, as long as they are taking their treatment. They've got a high white cell count, CD4 count, and their viral load is low. So there's no evidence that those people are at higher risk than any other person. Now, how do we know that somebody is infected? It's very important for us to know that there are people who are asymptomatic. Those people I was saying, they are posing very high risk to other people because they are walking around, they are not aware that they are sick. And people have flu-like symptoms. The literature, when they say people with flu-like symptoms, there are very other important symptoms they do not talk about, which are very common symptoms of flu, like blocked nose. Blocked nose, other people would have simply blocked nose, nothing else. Those people, in my view, they are also at high risk, they must be tested. People with sore throat, high temperature, that's fever of above 30 degrees and above. That's what is very necessary for our churches to have at least one or two reliable thermometers to check everybody who comes in, check his temperatures. I say reliable because most of the thermometers which are used in our malls are very, very much unreliable. I went to the mall this afternoon. My temperature was checked. It was 33.5 degrees Celsius. That's the temperature of a dead person. People who have headache and general body weakness and general body aches. There's a dry cough, which most of the time we ignore. Have a difficult in breathing. And sometimes we see so a patient may have an unexplained decreasing level of consciousness or become unarousable. Other people who present with abdominal pain or tummy pain or loss of smell and loss of appetite. Now, these are very, very ominous symptoms. If you develop these symptoms, that is fever, high fever, difficulty breathing, become unarousable, you must go to the hospital immediately. Because I want to say, to caution people from going to the local doctor's general practice. Because you go to the local doctor's general practice, it will refer you to the hospital. Maybe you will not reach the hospital. By the time you get there, you'll be dead. Unless the doctor of your local doctor will make a very strict follow-up and phone the hospital and make sure that the patient has been transported to the hospital timeously. Otherwise, go to the hospital immediately without delay. Now, how do we minimize the risk? I think it's very important to know that each infected people under normal circumstances, we may infect 2 to 3 people during the time that he has the disease. We'll infect 2 to 3 people. But in some areas with a very high transmission, like those areas I was referring to as congregate settlements, the transmission rate can be 3 to 7 people. One person infecting 3 to 7 people. That's why it's very important to go and identify and follow up the contacts. We will go to that. I'll show the figures, the figures that can result if we do not follow up on contacts and quarantine them. Now, to decrease the risk, we need to observe all the necessary precautions that I have alluded to and which Sister Karen is going to talk about. And we adopt very strict screening and sanitation at our church buildings, and other people will carry around their own sanitizers in their pockets. We have reliable thermometers. And the register is very, very important. Keeping the register will tell us if any member of the congregation is infected, is positive, it will assist us with contact tracing. We can contact everybody who is in the register and quarantine those people who are in contacts and isolate them. Okay, quarantine and isolation sometimes are used interchangeably, but they are not. Quarantining the people, we simply quarantining the asymptomatic contacts. Their conditions of placement are less strict than isolating. Isolating will isolate the positive patients when we put them completely isolated areas. They've got very, very minimal contacts with other people. The only people who can see them are the people who are bringing them the necessities, like food, the laundry, and so on. And contact tracing, rigorous contact tracing is very, very important. That's why other countries like South, what they've forgotten, those countries who became aware of this coronavirus, they adopted strict contact tracing, quarantining the contacts, and isolating the infected people. That's how they managed to control the disease. Now, the questions, we may entertain these questions during a question and answer session. How high the risk of children acquiring and transmitting the disease or the infection? And does it survive? Does surviving the infection confer lifelong protection? Well, people will know or recover from the disease, but does it mean they're free now? They cannot contract the infection again. I think that one we're going to discuss during our question and answer session.
Dr. Molaoa, thank you very much for that very insightful presentation. The first part of the presentation you dealt with was to explain to us the transmission and how it spreads. And I've divided it up into 4 simple questions: the how, the where, the who, and the what. How it spreads is through your droplets and so on. Where? In your congregated areas. Who? 60, 65, and people with comorbidities. And what? And you've listed some good things there, is identifying blocked nose, your sore throat, your high temperature, and so on. How, where, who, and what. And for our local congregants, brothers and sisters, and also the leaders in those congregations, please bear this in mind. How, where, who, and what are so critical to begin to get a handle on, so that we can also communicate this to our congregations. You then dealt with minimizing the risk, and you emphasize some critical areas that we have to look at: thermometers, registers, isolation, quarantine, rigorous contact tracing. And the most important thing that you did with us this evening was to give us some indication of how it spreads if we don't control it, and we don't contain it and hold it as fast as possible.